Welcome to The Future Inspired by You. I'm your host, Tim Fagan, Vice Chair of the Helen DeVos Children's Hospital Foundation Board. Thank you for joining us for this Impact Chat, where we'll be chatting live with our clinicians and leaders behind the innovations, advancements made possible by the generosity of you, our donors. Today's topic is innovation in stroke care, saving lives by saving time. I'm joined today by Muhib Khan, a vascular neurologist and the division chief of inpatient neurology for Spectrum Health Medical Group. He is also the director of Spectrum Health's Comprehensive Stroke Center at Butterworth Hospital and is a clinical associate professor of neurology at MSU's College of Human Medicine. And Dr. Tia Chakraborty, a neurointensivist working in the neuro ICU. She is also a clinical assistant professor of neurology at MSU's College of Human Medicine. Now, we invite you, our viewers, to type in questions for our guests in the live stream chat. And so let's get started. So, Dr. Khan, just give us a brief overview of the neurosciences at Spectrum Health.
Thank you for having us here. The Neurosciences Service Line and the Institute is the large institute with about 140 providers or so. If we look at the Neuroscience Service Line, we split it into inpatient services and outpatient services. On the inpatient services, we have the full breadth of services that can be provided by any comprehensive neuroscience service line, from vascular neurology to neurosurgery, neurocritical care, neurohospice, neurorehab, spine surgery, epilepsy, pain management, neuropsychology. And we have the outpatient clinical services that provide care, ongoing care, and as well as care for chronic neurological conditions. We're very proud of our ALS program, our brain and spine tumor clinic, our deep brain stimulation clinic, EMG nerve conduction, as well as neuromuscular clinics, epilepsy clinics, movement disorder clinics, multiple sclerosis. Stroke patients also follow up in the clinic for continued stroke care. We have neuropsychology clinics as well as spine and pain management center, providing outpatient care for neurological needs.
Well, it's quite extensive. So just tell us more about our stroke team.
Yep. So when we talk about stroke, it is important to know the impact of stroke on population in United States. About 800,000 or more patients suffer a stroke every year in United States. Spectrum Health overall at Butterworth Hospital deals with about 1,400 plus stroke patients. The Spectrum Health system, which includes all our regional facilities as well as our primary stroke center at Blodgett Hospital, combined with Butterworth Hospital, deals with about 2,200 strokes a year. The impact of Butterworth Comprehensive Stroke Center is tremendous in the region in West Michigan. As you can see, we provide care to patients who get transferred to us all the way up from northern Michigan to western Michigan by the lakeshore and down towards southwest Michigan as well. I do like to mention that stroke is not a disease of adults only. It also impacts children as well, and we collaborate extensively with our pediatric neurology colleagues at the Helen DeVos Children's Hospital in taking care of pediatric stroke patients as well.
Mm.
With the high volume, as I mentioned, it is important for the stroke program to maintain good quality of care as well. And we are very proud of our stroke centers, both Butterworth Comprehensive Stroke Center as well as the Blodgett Primary Stroke Center. We have received awards from the American Heart Association for high level of quality care, the highest level of awards that can be achieved by any comprehensive stroke center from the AHA. We provide 24/7 care. We have all types of expertise available. We can provide care to all kinds of complex stroke patients, and we are continuously working on improving our outcomes, our quality metrics, and improving the life of stroke patients as well as their caregivers in the long run.
So let's talk to our viewers about how we can, my knowledge on this is fairly limited. So Tia, how can we prevent stroke? I think that would be important to our viewers.
Absolutely. So modifiable risk factors in the prevention of a first stroke include hypertension or high blood pressure, high cholesterol or hyperlipidemia, diabetes, obesity, sedentary lifestyle or lack of exercise, tobacco and alcohol use, as well as cardiac arrhythmias, including what's known as atrial fibrillation. For instance, a healthier diet recommended by the American Heart Association consists of reduced sodium intake, increased potassium intake, as well as diets like the DASH or Mediterranean style diets. And a good exercise regimen that's also recommended by the AHA includes vigorous or moderate activity for at least 40 minutes a day for at least 3 days a week. There are also basic prevention measures, and those are encompassed by this acronym called FAST, F-A-S-T. And what that stands for is sudden onset of face droopiness, that's the F. A stands for arm weakness, S stands for speech difficulty, and T is then it's time to call 911. Time is brain, so the faster the stroke is recognized, the faster it can be potentially treated and even reversed.
Mm.
Another initiative that we're working on at Spectrum Health, alongside our Chief of Neurosciences, Dr. Aisha Ahmed, is to prevent strokes in communities of color in Western Michigan. And this project entails educating local groups about the risk factors I previously mentioned, and specifically addressing potential barriers to seeking health care that many of these minority populations face, including lack of health insurance, distrust as a result of racial inequities in healthcare, language barriers, and also prohibitive financial circumstances that they might face.
So let's talk a little bit about what happens to a stroke victim when they come to the hospital.
Sure. So during the triage process, we examine the patient at bedside in the emergency room and perform a very thorough neurologic exam. Then we obtain very quickly a CAT scan of the brain to assess for potential strokes, as well as advanced vessel imaging that looks for blood clots in the main arteries of the brain, and we call these clots large vessel occlusions. Treatment options for an acute ischemic stroke include TPA, which is a clot-busting medication given as an IV infusion, as well as endovascular thrombectomy, which is a minimally invasive procedure that can mechanically extract clots in the larger arteries in the brain that might be causing strokes. Both treatments are very time sensitive.
So our discussion today is about saving time, saving lives. So why does time matter so significantly in a stroke episode?
Yes. As a result of a stroke, 1.9 million neurons can die every minute. So that's why we neurologists say time is brain. To exemplify this, I'll tell you a patient tale of 2 strokes. A 74-year-old man recently presented at Ludington actually with stroke symptoms, which were promptly recognized. There, he had a CAT scan of the brain that was quickly done, and he was eligible for that TPA medication, so was given that and then sent to Spectrum Butterworth. At Butterworth, he then went on to undergo the endovascular thrombectomy and eventually had complete recovery. He then had another stroke 2 months later, again was given TPA, and then again had a thrombectomy at Butterworth. And remarkably, he recovered fully yet again. So it's because of this prompt timely recognition of his symptoms, the assessment, the management, and the treatment that both strokes were able to be entirely reversed. Had there been any delay, his outcome may not have been so fortunate.
Great. So Dr. Khan, tell us a little bit about how the technology has changed the landscape when it comes to stroke treatment.
stroke treatment has advanced significantly in the last 2 decades, and a lot of it has been due to advances in technology. As Dr. Chakraborty mentioned, we are dependent on imaging technology to help us guide our treatments. And before the technology advancements, we used to spend 90 minutes or so in getting the answer from our testing. Now, because of very smart artificial intelligence technology, we can get the answer from our scans in about 2 to 4 minutes. Another aspect of technology helping stroke patients is Telestroke, which is actually funded by donors like you out in the community. And we have a Telestroke program that is supporting regional hospitals like Ludington and other regional hospitals in West Michigan. Uh, we're also looking to expand into the technology avenue of robotics and looking into ways how we can provide the same level of expertise into the regions by leveraging robots that could be controlled by physicians out in Butterworth Hospital.
Well, that's incredible. Robots now with stroke. It's amazing. Just as a reminder to our viewers, if you have any questions or wish to chat regarding stroke that you'd like to ask the doctors, please use the chat feature. And now I have a question for Tia. What happens after a stroke when this episode takes place, and how does one recover from a stroke?
Spectrum has an inpatient rehab at Blodgett, which specializes in stroke rehab as well as other types of neurologic rehab. And Spectrum also has an extensive network of outpatient as well as in-home rehab programs.
That's great.
Spectrum wants to further strengthen our rehab efforts through technology that Dr. Khan was just speaking to support using robotic exoskeletons. Now, these are robotic-assisted gait and movement training devices designed to assist walking and movement in patients affected by stroke, and they do this through brain-machine interfaces. Spectrum also is involved in international research related to stroke recovery, and we'd like to continue to participate in global, domestic, and internal studies to enhance stroke recovery.
Great. Now, are there clinical trials underway that are involved with the stroke here in West Michigan?
So we are definitely involved in stroke clinical trials. When we talk about stroke clinical trials, the American Heart Association and the National Institute of Health wants us to focus on 3 aspects of stroke research. One is emergent stroke care. So we are involved in 2 clinical trials in the emergent stroke care. On the hemorrhage type of stroke, we're also involved in emergent hemorrhage treatment clinical trials as well. The second aspect that the NIH and AHA wants us to focus on is on the prevention of stroke. As Dr. Chakraborty mentioned, we are involved in research in how can we actually prevent a stroke from happening so that patients don't have to go through this tedious journey. We are involved with the NIH, the StrokeNet part of the NIH, as well as AHA in preventive research clinical studies to prevent stroke. We're also involved with the NIH in stroke recovery studies to enhance recovery after the stroke so that patients can return back to their usual day-to-day activities. So we have a very comprehensive research program as part of the Comprehensive Stroke Center program, which allows our patients access to cutting-edge technology that is not widely available to other patients out in the community. And we're very proud of our research program.
That's great. So what other areas, certainly need donor support that you can maybe share with us that possibly donors could get involved with?
Yeah. As I mentioned, research is an important aspect, and we consider research as an integral part of our program in order to continue to take part in research studies and also initiate research studies based on the ideas like Dr. Chakraborty ideas and other colleagues. We would like to embark on further research, and we would really appreciate the help from the donors for that. as I mentioned, we have received quality awards from the American Heart Association for providing highest level of quality of care to the stroke patients. In order to maintain high level of quality, we need support. We need people who monitor our quality, find gaps in our care, and then come up with plans to address those gaps. In order to do all of that, we need support, we need personnel, and we would appreciate donor help for that. We're also, as I mentioned, robotics is an avenue that we're working with our cardiology colleagues at the Heart and Vascular Institute. And in order to expand the robotics program, we would really appreciate the help from the donors. We're also looking at some new devices. As Dr. Chakraborty mentioned, a procedure that we do when we take the clot out as a thrombectomy. There are newer technology and devices coming out that could expedite that whole process, make it even better. In order to bring those devices and research around them, we would need help from our community and our donors. Dr. Chakraborty's work on preventive care and preventing a stroke in the future is also dependent on support from the community. We have a stroke fellowship now, and our first fellow will start in July. In order to maintain robust educational opportunities for future doctors and future stroke physicians, as well as neurocritical care physicians, we would really appreciate the help from our community and donors.
So we have a question, and this is one that's been asked. Thank you, regarding the timing of it. If let's say someone in our household assumes they're having a stroke, should we call 911 and wait for an ambulance, or should we drive them to the, what is, I guess, if I'm suspecting a stroke, what's the process and procedure that's best to take?
Okay. A lot of research has gone into what is the best way to seek medical attention. And after extensive research, as guided by AHA, the best course of action for anyone who is experiencing stroke symptoms or has noticed a loved one or a friend who is experiencing stroke symptoms is to call 911. And the stroke symptoms are the ones that Dr. Chakraborty explained earlier, the FAST acronym. If anyone in the community notices that, all they need to do is to call 911. That expedites the care way more than people driving themselves to the emergency room. So we always encourage the community to call 911.
So you gave us the acronym, but are there different types of strokes that we can experience then? And maybe what are those like? I guess from a curiosity standpoint, to be aware of what may be happening to ourselves or one of our loved ones.
Yes, absolutely. So there are different types of strokes, two main types. One is the ischemic type. I had mentioned acute ischemic stroke. So what that means is that the blood supply is cut off from a part of the brain. The other type is what we call hemorrhagic or bleeding type of strokes. So either way, you would still utilize that FAST acronym, and especially if you're seeing any sudden onset change, again, in your family members or loved ones, call 911. It puts the whole triage system into play from the ambulance on, and then we can take over the rest of the triage when a neurologist will come bedside, urgently assess the patient, and then go on to obtain advanced brain and vessel imaging for the rest.
Yeah, and when we began our discussion, I said I knew very little about stroke, so I was really looking forward to today. Can you tell if someone potentially has had a stroke in the past and maybe wasn't aware of it? Is there a way to diagnose strokes before, to meet with a patient and say, it looks like you've had a stroke, and how does that work?
Yes, there are certainly ways that we can tell if a patient has had strokes in the past, notably with that advanced neuroimaging that we do, be it a CAT scan of the brain, and then more specifically, we can do brain MRIs that tell us some more information and details on previous potential strokes.
So we've talked a little about some of the underserved communities. We've talked a little bit about it. Is it a hereditary disease? Is it something that if I have a history of stroke in my family, I should be more acutely aware of than if I haven't? And is that a factor that plays into stroke?
Family history is very important when it comes down to stroke. We have learned through research and observation over the decades that patients who have family members with stroke, it increases their risk of stroke as well. in addition to having family members as or family history of stroke as a risk factor for having stroke, some patients actually have some genetic abnormalities that make them prone to stroke, and there's genetic testing available here at Spectrum Health Butterworth Hospital to figure that out. We usually have young patients with genetic strokes that we come across, and we work closely with our genetics team here at Spectrum. Uh, but most of the strokes are preventable, and it is all about managing your risk factors and your lifestyle, as Dr. Chakraborty mentioned earlier. Uh, we cannot change our family, but we can change the way we live, eat, or exercise.
We have a question which I think is really insightful. Are we seeing more stroke patients due to COVID? And is there a neurological effect or any difference that you're seeing now during the COVID pandemic when it comes to stroke?
You want to go?
Yes, sure. So, it's tough to say if we're seeing more patients as a function of COVID that are having strokes just because of COVID. We wouldn't know that information unless we were, for instance, able to do a brain biopsy and look at the vessels. Research so far has shown that patients who have COVID can have what we call microvascular effects of COVID within the vessel walls, including vessels in the brain. Have we seen patients who have COVID and have strokes? Yes, quite a few of them. And those can be both types of the strokes I mentioned, either the ischemic type where the blood supply is cut off, as well as the bleeding type of strokes. So we have seen quite a few patients with strokes because of COVID.
Just one other question, and this is my own. Did you see a reluctancy to come in with stroke patients during COVID because of their fear and the effects of that?
Yep. So we did come across that issue, especially during the first lockdown. A significant number of stroke patients, especially the ones who were having minor stroke symptoms, decided to stay at home because of the fear of COVID, and also they were trying to help out the medical community by not overburdening the healthcare system. So we have come across patients who came in later than they should have for their stroke care, and unfortunately, because of coming in late, we were not able to provide them the kind of treatments that Dr. Chakraborty talked about earlier. We have also learned over the last few months through research internationally done, including us taking part in a major international research study recently published that did show that COVID does increase the risk of stroke slightly as compared to other viral illnesses or other problems. And that increase seems to be much more common in young population as well.
Really? So how young can you see a stroke? I mean, I always think of it as a disease of the elderly. You said that, is it in youth down to what ages out could you potentially see a stroke?
So you can potentially see a stroke from the time of the birth all the way up to 90 or 100 years old. Different reasons for stroke, but we have seen infantile strokes. Our pediatric colleagues at the Helen DeVos Children's Hospital deal with infantile stroke, or even before birth. Some children unfortunately could have a stroke while they're in the womb as well. And then we see strokes all the way up to 90s and 100s. So there's no age limit to stroke. There's no gender limit to stroke either. So men and women equally have stroke. Women are more protected in the earlier phase because of their hormones, but as after menopause, there's a significant increase of stroke in women as well. So both men and women, as well as young and old.
So if I've had a stroke, am I more susceptible and a higher risk factor for a second occurrence?
If somebody has had a stroke, they have a higher chance of having a second stroke as well. That being said, if you seek medical attention, work with your neurologist, your stroke neurologist, your primary care physician, take your medications regularly, follow the instructions on lifestyle modification of healthy diet and exercise, you can reduce your risk of stroke you can reduce your risk of second stroke significantly.
So we have a question here. I've heard of this too. What is, quote unquote, a mini stroke? Is there such a thing as a mini stroke?
So the term mini stroke sometimes can be a little vague and confusing for the people. When neurologist or stroke neurologist or neurointensivist like Dr. Chakraborty, when we talk about mini stroke, we are basically talking about two things. One is, what are the deficits from the stroke? If the deficits are just slight numbness or maybe a slight facial droop, that tells us that it is probably a mini stroke. The other way we look at mini versus a bigger stroke is how much of an area in the brain is affected by the stroke. And that's where all the imaging that Dr. Chakraborty talked about, CT scan and MRI, helps us in understanding how big the stroke is. I just want to be very clear to the community out there, no stroke is trivial. It is just terminology that physicians use to communicate with each other and to the patient. But a mini stroke is as serious as a big stroke. So just want the community to know that they need to have the same type of medications and same modification in their lifestyle, regardless of whether they had just very minimal deficits from a stroke or a big one.
So are stroke and heart disease related?
So stroke and heart disease are related from two aspects. One is the same risk factors for stroke, as Dr. Chakraborty said, the high blood pressure, the diabetes, the high cholesterol, are the same risk factors for heart disease as well. So if patients have uncontrolled diabetes, hypertension, or high cholesterol, they could have both heart problems as well as the stroke. So that's one place where there's interplay of heart disease and stroke. The other way is when the heart gets weaker and its function is deteriorated and its rhythm is abnormal, that can actually lead to a stroke as well. So yes, both stroke and heart disease are very much related with each other. Stroke, the other way is when the heart gets weaker, so its function and changing the rhythm of the heart is abnormal, that very closely as a cardiovascular. So yes, both stroke and heart disease are very much related with each other. Stroke itself can actually cause heart problems by reducing the function and changing the rhythm of the heart as well. We work very closely with our Heart and Vascular Institute. We have a board where we meet once a month to discuss all the cases where there is an interplay of heart disease with stroke. We call it the Brain Heart Board, and it has been successful in discussing patients and coming up with a good plan with consensus.
So I like that, the brain heart board. It makes me feel comfortable that there is a brain heart board looking out for us. So that's good to hear. One other thing is, how long does it typically take? And certainly I'm sure there's severity differences in stroke, but typically how long does it take to recover from a stroke episode?
Sure. So it depends on a few things. As you mentioned, the severity is a large factor in the time to recovery, but also what was the treatment? If there was timely treatment, it goes back to the whole time is brain thing. If we were able to give TPA, that IV medication, or do the thrombectomy and take the clot out mechanically, patients can recover very quickly. And by very quickly, I mean even in less than a day, and fully recover. And fully recover in a timely fashion, like the patient who I told you about did twice over. In other cases in which maybe they weren't eligible for the TPA or other intervention, it can take longer if the stroke lasts. That time, again, depends on the size of the stroke, how much of the brain area is affected, as well as the deficits that the patients came in with and what they evolved to be. And so it can take anywhere from weeks to months, and sometimes in some cases, if it's a very large stroke, years. But that's why there's rehab, and there are many different ways to approach rehab. And now we're trying to utilize technology to help maybe perhaps even expedite the process and make rehab more effective.
So I've heard a little bit today about robots helping. I've heard some things that we're working on clinical trials. Where do you see research going with regards to stroke, let's say in the next 3 to 5 years? What's that vision look like as far as stroke treatment and prevention?
So two things that American Heart Association would like to achieve in the next 3 to 5 years, that's actually on their roadmap, is to reduce the incidence of stroke, which is where Dr. Chakraborty's work is extremely important. I actually just came across a paper just published by AHA a few days ago, in which they assessed all the counties in the country on how the incidence of stroke has been over the last decade. Unfortunately, Michigan's incidence has not gone down as much as AHA wanted it to be. So that is a significant area of research and intervention that we need to do to actually prevent the strokes from happening in the first place. The other thing that AHA wants to focus on is to reduce the mortality or death from the stroke. Unfortunately, in Michigan, we have not achieved the benchmarks set by AHA for that as well. So there's a tremendous opportunity for improving care for our patients in terms of preventing stroke as well as preventing death from stroke as well. In addition to those, stroke recovery is a major avenue of research, and we are lucky to partner with international collaborators on it. And that is going to be the next frontier for stroke research and improvement.
So if we think about the emotional and physical well-being of the patient, can my lifestyle when it comes to stress increase my risk of stroke also?
Absolutely. So stress can exacerbate the risk factors we talked about, especially high blood pressure. Stress can certainly drive your blood pressure up, and it can drive you to eat more, quote unquote, unhealthy things, drive up the cholesterol, lead one to not be prone to exercise as much as they might need to, for instance, or even parlay into tobacco or alcohol use and too much alcohol use, for instance. So all these things are huge risk factors that are evidence-based, that have been figured out through extensive research studies that are risk factors that can be modifiable, and stress can certainly be at the root cause for all of those things.
And one other question, and this is, I guess there's no dumb question. So in a case where you have, let's say, a blood clot, I get a blood clot in my leg from whatever, is there a direct relationship with stroke with that, or are they two separate things? If they have you on Coumadin or whatever it may be, is that a precursor to stroke, or?
So it depends. There are instances and particular types of stroke that could be caused by a blood clot in other parts of the body, including the leg. But that would require thorough investigation and consultation with a stroke neurologist to figure out if the blood clot in the leg was responsible for the stroke in the brain. It is possible, and we have seen patients with that kind of situation.
So does stroke cause then a permanent brain damage and or memory loss in some cases that's not repairable?
It can, but again, it depends. It all comes back to, most importantly, time, the time that the stroke occurred over. Again, if there were potentially interventions that could have reversed the stroke or made the stroke smaller, where those things could certainly improve or be completely reversed. Unfortunately, with bigger strokes or strokes that can't be treated for whatever reason with a TPA or thrombectomy, that could be the case where the memory could be affected or there could be other irreparable harm, so to speak. But again, with rehab, the hope, and oftentimes there is much recovery and improvement over the course of time.
Well, when you were talking about how many brain cells were,
Right.
well,
1.9 million
yeah,
a minute
so
can die.
that's so again, the quicker you can get to
Yes.
have care, the main theme is the better you'll be served with it.
Yes,
Right.
absolutely.
Good. Well, one other thing we'd like to talk about here are hospitals equally prepared to handle stroke. I know we have a lot of our satellite hospitals in Reed City and certainly all over West Michigan. Are most of the facilities prepared to handle stroke, and how does that work if I may not be near, let's say, the center of Spectrum, downtown Grand Rapids?
So the simple answer to that question, no. Not all hospitals are equally equipped to take care of all kinds of stroke. The American Heart Association and the Joint Commission actually certifies hospitals according to their capability of taking care of stroke patients. So some hospitals are certified as acute stroke ready hospitals. Those hospitals can receive a stroke patient, give some kind of emergent therapy, including the clot busting medication, TPA, but then they have to transfer those patients to a more robust stroke center. We have primary stroke centers like Blodgett Hospital that can give clot busting medication, and if those patients don't need any further procedures, can keep those patients in Blodgett Hospital and continue to treat them. But then if Blodgett Hospital needs, if a patient presents to Blodgett Hospital that needs more advanced therapies like the thrombectomy that Dr. Chakraborty talked about, then those patients need to be transferred to Butterworth Hospital. Similarly, out in the regions, as of now, if the patients get clot busting medication or need a procedure called thrombectomy, then they need to be transferred to Butterworth Hospital. I encourage the community that wherever you live, and if there is a hospital close to you, try to find out what kind of stroke care they provide so you are well prepared ahead in case you come across an emergent stroke.
Okay. So I have one more question. In the case of stroke, is most of the time the care for it an inpatient care where you're admitted into the hospital, or is it an outpatient care where you go home and are on a medication, and maybe is it a little bit of both, or what's the average hospital stay?
Yeah, it can be a little bit of both, depending on the severity, if there were treatments given, or if we talked a little bit about the mini stroke. If it is a mini stroke and the deficits are very minor, the stroke symptoms are really minor, then what we might do is put patients on medications for appropriate stroke prevention and then follow them up in the outpatient setting. Alternatively, if they do end up getting a stroke treatment or have more persistent stroke symptoms, we'll admit them to the hospital, be it to the stroke floor or to the ICU, the neuro ICU, and watch them more carefully and give them more treatment and start the rehab process as quickly as possible.
Well, thank you both. You know, today for me has been really informative. I said I walked in here today and knew very little about stroke, and now I feel much more prepared. I guess I'll go for a run this afternoon just to make sure I keep my exercise up at least 3 times a week. I'm not going to say it's going to be a fast pace, but we'll give it our best shot.
Good, yes.
At least we get out and move. Well, that concludes today's event, and a special thanks to our physicians for leading us through this incredible, important topic. Before we close, please mark your calendars for the next Impact Chat. That'll be on June 17th at noon. Our topic is neonatal intensive care unit and the family-centered care. Again, thank you to our donor community. Your generosity makes this kind of transformative care possible, and thank you again